Hi, I'm Dr. Rahman, and welcome to Black Women's Health Podcast. Women have been saying and telling me that it's been very difficult to do two things. Very difficult to get a GYN appointment. In fact, I had a guest that stated it took her approximately 4 months between calling to actually getting an appointment date for her GYN exam. The other thing that women tell me is that it's hard to find a Black GYN, OBGYN, that Black women. So there's two things that women routinely tell me: hard to get a GYN appointment, hard to find a Black OBGYN. I've heard incredible stories about women spending hours going through their provider manuals and then Googling in hopes that they would find a Black OBGYN. But I should say that the nature of OBGYN has changed over time. When I was training many years ago, I was taught that the GYN exam was a full body exam from head to toe, and that also included a rectal exam. But over time, the decision was no, we don't need to do all that. We should limit our examination to a clinical breast exam, a pelvic exam, and a pap smear. So that became the expectation. Irregardless to this change, women still expected to have to take their clothes off in order to have a GYN exam. And I can say that in the past, I have detected things that may have gone undetected for a while based on having done a full body exam in the past. And I have tended to continue with that because it really doesn't take that much more time to include inspection of the back and the chest and lower extremities, thyroid. It doesn't really take that much added time. But I should say that the typical GYN wellwoman visit, meaning she's coming not with any specific complaint. She's coming because it's time for her annual wellwoman visit. The expectation: clinical breast exam, pap smear, pelvic exam. Well, that's changed. And what is now said is that we no longer need to do a clinical breast examination. And that's because several societies, including the American Cancer Society, has stated that doing a clinical breast examination is not an effective way to screen for breast cancer. They have stated that the most effective way to screen for breast cancer was with a mammogram. The U.S. Preventive Services Task Force previously had recommended that women start getting these mammograms at the age of 50. They've since lowered the age to 40. Now everyone seems to be in accord that women should start screening mammogram starting at the age of 40. And I am talking about women who are at average risk, meaning they don't have a genetic mutation, which would put them at an increased risk. They've not had a previous history of breast cancer. They've not had a previous biopsy which showed a high-grade lesion, and they've not had radiation to their chest prior to the age of 30. Given those four scenarios, if you answer no to those four things, the odds are you're probably at average risk. And these are the recommendations for women at average risk. And you have to wonder, what about Black women and our incidence of breast cancer? Now, our incidence of breast cancer is comparable to white women in this country. However, our mortality rate is 41% higher compared to white women. There was a study done which said if you just lower the age for Black women to age 40, you could decrease the breast cancer mortality rate. And so taking that in consideration, taking the revision of the recommendations from the U.S. Preventive Task Force, all women should basically start screening mammograms at the age of 40. The U.S. Preventive Service Task Force has also gone on to say that these mammograms should be done every 2 years and that they can stop at age 74. In reality, what I tend to see, or what I've seen in the past, is that women will start around the age of 40 and they get mammograms every year. Because there's just such a visceral fear of being diagnosed with breast cancer. Our impression is if we do it more often, we're more likely to detect it. That really hasn't panned out, but I'm not here to argue whether or not you should or you should not get it once a year or every 2 years. The one thing I would say is that women should do breast self-examinations. Now, again, the U.S. Preventive Service Task Force said this is not an effective way to screen for breast cancer, but I believe you need to know your body. You need to be comfortable and aware of what your breasts feel like. Often you will notice that your breast has texture. It's not just smooth like the back of your hand. If you start to appreciate what your breasts feel like, you are more likely, in my opinion, to notice a change. And noticing a change is enough to warrant further evaluation. So breast examination by your doctor is no longer a recommendation. So not needed, but get your mammogram. Pelvic exam. Now that's an interesting thing. There have been studies that have suggested that in an otherwise asymptomatic woman, meaning she doesn't have any complaints such as discharge, abnormal bleeding, pelvic pain, no other complaint, i.e. she's coming for her wellwoman visit, just a checkup to make sure everything's okay. The recommendation is in that asymptomatic woman, a pelvic exam is no longer necessary. In fact, the American College of OBGYN and the American Academy of Family Practitioners have basically agreed, asymptomatic, not pregnant, she doesn't need a GYN exam. She does, and that, when I say GYN exam, I'm talking about spreading your legs and putting your feet in the stirrups so that your vulva, vagina, and your uterus and nexa can be palpated. Not necessary, which means that if you're going for a GYN exam, there's a high probability you may not need to take your clothes off at all because clinical breast exam is no longer considered necessary. And in an otherwise asymptomatic woman, no longer considered necessary. So why do you have to take your clothes off? You don't. You don't. And that's a big difference because with these changes, if women don't understand the reason why, and they go to the gynecologist and nothing happens, she doesn't examine your breast, she doesn't do a pelvic exam, you think she's not a good doctor. She's not doing her job. but actually what she may be doing is following the latest recommendations. But you say, well, wait a minute, what about a pap smear? Don't I need a pap smear? And that's evolved over time. Again, back in the day, it used to be she needs a pap smear when she becomes sexually active or when she turns 21, whichever happens first. That's changed. That's changed. And now there's a PAP and an HPV test, and HPV is screening for human papillomavirus. The thought is that you have to get this viral infection and you get this through sexual contact. If you come in contact with HPV and you don't clear this HPV infection over time, the virus can start to induce abnormal changes, which could lead to cervical cancer. And so a pap smear is not a pelvic exam. A pap smear is a specific screening test for abnormal cells that could have the potential to develop into cancer, cervical cancer. So pap smear screening for cervical cancer. Pelvic exam, that's the whole 9 yards. That's the external examination, that's the vaginal exam, and then that's the palpation, feeling for your uterus, an enlargement or tenderness of anexa, ovaries, and tubes. So in an otherwise asymptomatic woman, pelvic exam, not considered necessary. Well, how often do you need the pap smear? That's been revised also now with the co-testing. That's pap and HPV. HPV to see if she's been infected with the high-risk human papillomavirus. Pap smear to see if any abnormal cells are detected from her cervix. With the two tests together, the recommendation is screening should be done every 3 to 5 years. So, does that mean you only need to see the gynecologist every 3 to 5 years for your well-woman exam? My suggestion is the following. My suggestion is you don't need to go to the GYN for your screening test. You don't need to go to the GYN for a script for your mammogram. You don't need to go to the GYN for screening for sexually transmitted infections. You don't need to necessarily go to the GYN for your pap smear unless your primary care physician is totally uncomfortable with doing a pelvic exam or inserting a speculum, doing a pap smear. If your primary care doctor is capable of doing that, you don't need to come to the GYN. So when would you need to see the GYN? You need to see the GYN when you're having a female issue or concern. Pregnancy, obviously, to see the OBGYN. You need to see the OBGYN if you have pain, bleeding, discharge, endometriosis, polycystic ovarian syndrome. A GYN issue, a GYN concern is when you should see the GYN. Basically, we should treat the GYN like the specialists that we are. Consider this. You don't go to the cardiologist because you have a heart. You go to the cardiologist when you have a heart issue. Likewise, with the GYN, you don't need to go to the GYN because you have a vagina. You go to the GYN when you have a GYN issue. So I'm saying save the GYN for the GYN issues. If you haven't been able to schedule your wellwoman GYN visit, no worries. See your primary care physician. I do feel as though every woman should have a primary care physician. In the past, it was said, well, younger women are basically healthy, and so they don't need a primary care physician. They can just go to the OBGYN. But I say we need to reconsider this, given the incidence of obesity, hypertension, our use of ultra-processed foods. Everyone should be seeing a primary care physician and seeing the gynecologist, the OBGYN, as needed for female issues. So my recommendation, in addition to every woman should have a primary care physician that they should see on a regular basis, I also recommend that every woman should have an ultrasound. An ultrasound should be done every 1 to 2 years. And I say this not so much so that we can detect ovarian masses, although that may be a possibility, but I'm saying because of the incidence of fibroid tumors, particularly in Black women. Fibroid tumors are common enough that we should screen women for fibroid tumors before they become symptomatic. And that's a radical change from what I have been taught in the past. The past was, if she's not having a problem, leave her alone, meaning that if the fibroid's not causing abnormal pain or abnormal bleeding, leave her alone. I'm saying no. She should know, a woman should know if she has fibroid tumors so that she can be proactive, change her diet. There have been studies that have suggested with smaller fibroids, using green tea, taking vitamin D supplements. And we know that a lot of Black women tend to be vitamin D deficient. And it's possible that just doing those things may help to slow down, possibly slow down the growth, reverse the growth of fibroid tumors. There is actually a study being done to evaluate this. And as we get more proactive about how we manage fibroid tumors, we need to know. We need to know. And one of the ways we can do that, we need to know and we need to be able to monitor, is by doing mammograms is by doing pelvic ultrasounds every 1 to 2 years. So my recommendation is see your primary care physician, get your mammogram starting at the age of 40, get a pelvic exam every 1 to 2 years, and see your gynecologist whenever you have a GYN issue.